This is Eric Lloyd, master's student in clinical psychology, neuropsychology concentration. I wanted to read this article from the Epoch Times. This issue came out May 14th through 20 of 2020. This one was pretty interesting because it talked about a bit of the strategy that went into the national lockdown. It says the two mistakes that led to a national lockdown. Mark Tapscott. News analysis. Michael Bloomberg's doomed campaign for the 2020 Democratic presidential nomination was only days away from crashing when he wrote his strategy on March 1st for fighting the CCP virus. As president, I'll trust the science and let the experts do their jobs, Bloomberg wrote on Twitter. 3 days later, he quit the race. Bloomberg's declaration of faith in science was repeatedly echoed by other candidates, elected by bureaucratic officials, medical and scientific experts, and influential journalists like Fox News' Chris Wallace, who declared on March 27th, "All I can say is trust the science, trust the science." Lockdown. President Donald Trump did just that on January 31st by restricting travel to the United States for those who had been in China in the prior 14 days. The CCP virus, also known as the novel coronavirus, first became public the month before in Wuhan, China. Trump did so again on March 13th when he declared a national coronavirus emergency, and on March 16th when he issued national guidelines instructing all Americans to avoid groups of more than 10 people and to remain at home whenever possible for 15 days. If everyone makes this change or these critical changes and sacrifices now, we will rally together as one nation and we will defeat the virus. We're going to have a big celebration all together, Trump declared during his daily coronavirus media briefing. Trump experts notably, Dr. Anthony Fauci, longtime director of the U.S. National Institute of Allergy and Infectious Diseases, and Dr. Deborah Birx, the White House Coronavirus Response Coordinator, declared the measures would flatten the curve of new CCP virus cases enough to prevent the healthcare system from being overwhelmed and thus buy time for effective treatments and a vaccine to be developed. By March 30th, virtually the entire nation was under lockdown for at least another month or until further notice. By the end of April, unemployment was the highest since the Great Depression in the 1930s. More than 33 million Americans are now unemployed. To date, more than 83,000 Americans have died, most being 65 years or older or suffering an underlying condition such as heart disease, chronic obstructive pulmonary disease, or diabetes. I think I just read something as of recent today that it's up to 95,000 at this point. Friday, May 22nd, 2020. Trump unveiled a phased-in relaxation of the lockdown in mid-April, but not without heated criticism from experts such as the Mayo Clinic, which reported April 17th that new projections suggest social distancing may need to continue through 2022. Such predictions sparked thousands of citizen protests demanding to be allowed to return to work, church, beaches, restaurants, and other aspects of everyday life. Flawed models. How did America get to this point? Two critical CCP virus response mistakes stand out: relying too heavily on flawed statistical models and failing to target resources primarily to protect the most vulnerable Americans. At the heart of the first error, two models have most influenced policymakers and media reporting. The Imperial College and London model from Great Britain and the Institute for Health Metrics and Evaluation, IHME, at the University of Washington. Trump and other officials in the White House and leaders of both parties in Congress have repeatedly warned that as many as 2.2 million people in the United States could die without urgent official action, a forecast generated by the imperial model. That forecast, which made a national lockdown seem imperative, wouldn't hold up. Neil Ferguson, the imperial model's creator, has a history of exaggeration and faulty assumptions. The IHME model has been similarly criticized. The two models have been all over the map. The imperial model projected U.S. total deaths at more than 186,000 by the end of May. Here we are, it's May 22nd. The IMHE projected 80,000, down from 161,000 in late March. The actual U.S. total as of May 13th was slightly more than 83,000 deaths. May 13th, 2020. Such variability doesn't surprise Norbert Michael, the director of the Heritage Foundation's Center for Data Analysis. Even if you have the best data, forecasting anything is inherently risky. And if you're trying to forecast over more than a very short period of time, it's just very dicey. Norbert Michael, the director of the Heritage Foundation's Center for Data Analysis. It's pretty good insight there. Generally speaking, with the data that is available to everybody, people like those who did the Imperial College one, the IHME, they're all using the same sort of tools, the same sort of statistical models, and they're all very sensitive to the assumptions you make, Michael told the Epoch Times in a recent interview. So even if you have the best data, forecasting anything is inherently risky. And if you're trying to forecast over more than a very short period of time, it's just very dicey, he said. Thus, statistical modelers must make assumptions about numerous factors that shape projections. Michael noted the impact of testing. If you have a lot of new testing going on, that's going to give you more cases. So to get a full picture, you really need to know how many new tests there are out there and what percentage of those tests were positive. But we don't have that data. An additional problem is the model's lack of transparency, according to Michael, as the makers of the models don't make available to other researchers their code. You don't have to give everybody your data, but you can give everybody your code and let everybody see what you're doing and see if they can replicate what you're doing, he said. That's the key to any kind of scientific endeavor. That's a basic scientific principle, so that's a big problem. I have a huge problem with that. No wonder the National Bureau of Economic Research recently observed of the models. In some, the language of these papers suggests a degree of certainty that is simply not justified. Targeting the vulnerable. The second mistake flowed directly from the first, according to Carl Derenbach, a Colorado attorney engineer who closely studied COVID-19 death rates. When New York started publishing age-related underlying condition data, that was a huge signal the virus is fatal to a very specific group of people, Derenbach told the Epoch Times. Having 327 million people behave in a way to save maybe a third of the population, it just seemed like there's a better way. You should be concentrating on those people, he said, over 65. Derenbach's point, prioritize protecting the most vulnerable while allowing most normal activities to continue. is evident in a comparison of New York and Florida. 1 in 5, 20.5% Floridians are 65 or older, compared to 1 in 6, 16.4% New Yorkers, making the former the state with the second largest elderly population and the latter the fourth largest as a percentage of the total, being Florida and New York. Derenbach said he noticed early in the crisis how Florida Governor Ron DeSantis just immediately jumped on the old age communities and how that was where they were concentrating all their efforts. It just seemed such a logical approach, and I was amazed at how that message never filtered through to the mainstream media. The resulting difference in per capita COVID-19 deaths in the two states is shocking, even given variables like population density. 137 per 100,000 New Yorkers, the highest in the nation, compared to 8 in Florida as of May 11th. Derenbach conceded that policymakers were in the dark early on in the crisis. I can't really fault too many people early on because I don't think we had the information we needed, he said. Second outbreak? The problem now, as the lockdown recedes, is that the lethal virus may come roaring back because of the flattened curve delayed but didn't arrest it. Because the flattened curve delayed but didn't arrest it. The lockdown has successfully slowed the spread of it, but that means once we lift it, it's going to spread. Stanford University medical professor Dr. J. Bhattacharya told the Hoover Institution's Peter Robinson in a May 8th interview. I think in the back of people's heads is the idea that we can somehow eradicate the disease if we just stay locked down. Bhattacharya said, that is not possible. We have to come to terms with that. Meanwhile, on May 2nd, Pelosi unveiled yet another proposed $3 trillion coronavirus rescue bill, saying ending the lockdown must be done on the basis of science and data. That's the end of that story. The two mistakes that led to a national lockdown. Epoch Times. Thank you.